Hi there. Welcome into the office. My name is Claire, and I'm going to be your neurologist for today. It's great to see you. We're going to do the cranial nerve examination today, right? Perfect. If you don't mind, I would like to add some tests to this examination, which consists the examination of your coordination. Is that okay with you? Yes? Perfect. And we go ahead with that too. Great. Okay, well then the complete examination will consist the following tests. First, we're going to test your sense of smell. Then we're going to test your visual system. Then we're going to test the sensations in your face. Then we're going to test your hearing system. And last, we're going to test the coordination of your upper extremities. Is that okay? Great, sounds good. Perfect. Well, you can just sit back and relax. I'm going to take care of you. Okay, and we're gonna get through this together. So I'm going to put on my gloves and then we can get started. Okay? Great. Well, I'm going to start asking questions about your sense of smell. And hereby we're going to test your olfactory nerve. Have you noticed any changes in your sense of smell lately? No? Good. Well, then we're gonna go ahead with testing that, okay? Yes. If you would like to block your right nostril for me, please. Yes, that's good. Could you please tell me what this odor most smells like? Coffee. Very good. Okay. The second one. And this one. Lavender. Very good. Okay, and then please block your left nostril for me. Yes. What does this smell like? Paint thinner. That's good. It's not a very pleasant smell right now. Last one. Roses. Very good, very good. Well, you had all the smells correctly, so I think your olfactory nerves are in very good condition. You passed this test, this first one. Very good. So if you don't mind, we go ahead with the second one, okay? Great. So now we're going to assess the visual nerve, which means I'm going to test your visual system. And I'm going to start by looking at your pupils. I'm going to see if the shape, the position, and the diameter are both equal. Yes? So you can just relax. I'm going to open your eyes with my hands and look into them, okay? Very good. Just relax. It's okay. You're doing very good. Yes. Okay. Okay, that looks good. Now the other one. Very good. Yes. Yeah, that looks really good too. Okay. Perfect. Yes. Well, both look equally, so that's good. Yes. Then I'm going to continue by shining my light into your eyes. Just look at my eyes and relax, okay? Okay, good. Very good. Other eye. You're doing good. That looked good. Okay. Then I want to do the swinging light test. That means that I'm going to shine the light from one eye to the other and back and forth and back and forth. Okay? Yes. Just relax. Okay. Okay. Keep looking at my eyes. You're doing very good. Very good. Yes. Perfect. Very good. Last time. Okay. That looks good. I didn't see any defects on your pupils. They contracted very well the first time that I shone the light in your eye, so that looks normal. Everything looks okay, which means we are ready for the next test. Are you? Yes? Are you good? Okay, perfect. Let's continue. Well, we're going to test your visual fields now, and I'm going to start with your central visual field. Okay, perfect. So I would like you to cover one eye for me. Very good. And I would like you to tell me right now, can you see my whole face? Yes, you can. Good. And is any of it blurry? No? Okay. Then please, we continue with the other eye. Cover it for me. Well done. And then, can you tell me, is my face blurry at any part? No? And can you see my whole face? Yes? Okay. That's very good. Perfect. Then I would like to continue to test your peripheral field. Okay? Great. And I'm going to do that with the counting finger method. So please cover one eye for me again. Yes. And you can just tell me how many fingers you think I'm holding up. That's it. Okay? Good. Well, we're going to start. Good. Very good. Perfect. Perfect. Okay. Yes. Okay, good. You did well. Please cover the other eye for me. We're going to do the same thing again, okay? Great. Okay. Good. Excellent. You did well. Yes. So your central visual field is all right, and your peripheral vision is also good. So that means that we can continue to our next test. Are you ready for that? Yes? Are you relaxed? Are you good? Yes? Okay. So let's continue, alright? So now I'm going to test your trigeminal nerve, which means I'm going to test the sensations in your face, okay? And I'm going to use this object for it. It's a soft and round object, and I'm going to touch your face with this, okay? And I want you to tell me if this feels like a soft touch. It does? Good. Now the other side. Does it feel like a soft touch on that side too? Okay, that's good. And compare both sides for me, please. Did it feel equal on both sides? Yes? Okay, that's good. I'm going to do the same test, but then with a sharp object. In this case, a needle. Don't worry, I'm not going to hurt you. I just want you to feel the difference between a sharp object and a soft, round one, okay? Did that feel sharp? Good. This side. Feels sharp too? Perfect. And did it feel equal on both sides? Okay, very good. Well, it seems that the sensations on your face, so your trigeminal nerve is in good shape. Yes, that's very good to hear, right? Okay. Well, I'm going to continue by testing the strength of your muscles in your jaw. Okay, so I'm going to touch your jaw here, and then your jaw or your cheekbones, your temples right here. Okay, and I would like you to clench your teeth for me really hard as you can. Very good, and relax. Okay, good. And again, clench your teeth together. Good, and relax. Okay, and again, clench your teeth. Very good, and relax. And clench them together again, and relax. Okay, that felt good. Yes, your muscle construction, the strength of this it feels very good. So I think this also seems very, very good. Yes, are you happy that everything's going so well? Yes, I can imagine. Well, I didn't expect any different, but it's always good to know, right? Perfect. We'll continue. We have a couple of tests to go still, so yes. So I'm going to test a reflex here, which is called the Corneal Reflex, and it's going to involve me just touching your eye with a tissue. I'm going to take one out. And I would like you to keep your head straight. Don't be afraid. I'm going to twist this out apart. And I want you to look at completely at one side from me. And I'm going to touch your eye with this tissue, okay? 1, 2, 3. Okay, that was very good. That was a normal reaction. Yes. Now the other side. Please look at the other side for me. Perfect. Here we go. 1, 2, 3. Okay. That looked very good. Yes, very good. So now I want to check for any hearing loss. Okay, so I want you to close both eyes for me. And I'm going to ask you if you hear a soft sound in one ear. You do? Good. In what ear do you hear that? Very good. Okay. Keep them closed. Keep your eyes closed. And again. Do you hear a soft sound? Good. In what ear? Very good. Okay. So next I am going to whisper some words in your ear. And I would like you to repeat after me what you hear, okay? Are you ready? Okay, good. Unicorn. Unicorn. Very good. Sleep trigger. Sleep trigger. Very good. Excellent, excellent. Last one. Claire. Okay, you did very well. There's no hearing loss detected. There's everything seems good. Yes. Well, congratulations. You did very well on your cranial nerve exam. Yes, everything looked normal. So you passed the test flawlessly. Yes, very good. So like I asked you at the beginning of this examination, I would like to do a couple more tests to examine your coordination of your upper limbs. Is that okay? Yes, perfect. So we're going to start with your fine finger movements. And what I would like you to do for me is to take your right hand like this and tap your index finger on the crease of your thumb and make quick movements. Okay? Just like that. Very good. And I'm going to look at the movements you make, okay? Keep doing it. Yes, yes. Very good. Very good. Perfect. Good. Okay, you did good. And now the same thing with your left hand, okay? Okay, good. Okay. Yes. Okay. Yeah, you can stop now. Yes, that looked very good. I looked at the rhythm, which was regular. I looked at the amplitude, which was full. You had a full amplitude, and it was very precise, so everything looked normal. So you did good on the fine finger movements. Thank you. So we're gonna move on to testing your rapid alternating movements. Yes, there are many ways to do that, but what I would like you to do for me today is to put your right hand on top of your left hand and make movements like this. Back and forth, and back and forth, and back and forth. And try to make full movements. Yes, and try to hit the same spot every time. Yes, could you do that for me? Please start with your right hand on top of your left. Okay, I'm gonna watch the movements, okay? Yes, yeah, very good. Yes, very good. Okay, you're doing good. Now the other way around, your left hand on top of your right, back and forth, and back and forth. Okay? Yes. Okay. Very good. Yes. Well, that looked very good. Yes, those were perfect movements. So let's continue to the last test, which is the finger to nose test. And as you can imagine, it involves a finger and a nose. So I would like you to put your right index finger, for starters, at your nose. And then I'm gonna hold up my hand, and I would like you to touch my finger. So start with your nose, and then touch my finger. Back to your nose, back to my finger. Back, forth, okay? Yes? Okay, let's start again with your right hand. Okay, your right hand. Okay. Back, forth, 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 back, forth. Okay, very good. Now the same thing with your left hand. Okay, put your left index finger on your nose and touch my finger. Okay. Back, forth, 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 back, forth. Very well. You did great. That was the last test. And you passed it. Yes. I think your coordination is very, very good. So you don't have anything to worry about. You passed both your cranial nerve exam flawlessly, but also the examination of your coordination of your upper limbs. So you're all good. Yes? Are you happy? Yeah. I didn't think you had anything to worry about, but it's good that you know now, okay? Yes. So I wish you a lovely day, and I would like to see you again someday. Yes? Okay. I'll see you soon. Bye-bye.